The neck zone is important for treating complaints to the head, neck or shoulder area. And at the same time, the neck zone is a reciprocal zone for both the lower back and lower abdomen. Many women complain of increased tension headaches during their menstrual period, so that's why this is a very good place to treat. So the neck zone location is between the hairline of the neck and then along the upper trapezius, which is down here, which is covered by clothes. So this is the area to treat. We're going to treat both sides of the neck and we're not going to touch the spine. So to begin therapy, what we're going to do is turn the device on. It's going to be in basic mode. And what we're going to do is put the device on the skin. Now, before I do that, just want to clarify, you will choose a setting in accordance with the type of pain. For example, if you have tight muscles on the neck, I'd recommend relaxation. So what I'm going to do now is I'm going to put the device on our patient's neck and I'm going to turn the device up till she feels a gentle tingle, and just give me a nod of your head when you feel that. Okay, so our patient's happy with that. Now, all through the treatment, you can change the setting. It doesn't matter, change the energy level. It really doesn't matter. As long as the energy level is comfortable for your patient, not too strong, and strong is not always better. So what we're going to do is we're going to start from the hairline and drag the device down here, working our way out. And I'm going to do that 3 times. So I'm going to start here. Are you okay with that?
Yes.
And I'm dragging down, I'm looking for those key points, which is stickiness, sound, the patient sensation where the signal gets stronger, and of course redness. And if you hopefully can see straight away, there's a little bit of redness here. And I've got quite firm pressure, but I'm not pressing too hard. It's quite sticky there, and I'm not going to remain on any areas yet. It's a really simple one to do and fairly quick. Now I've got resistance here, I'm going to come back to that, and maybe in this video you can see that redness coming up. And another red spot here just next to the spine, so it's stuck there. Now at this stage you can stay there, or you can brush the area and change the stickiness, or you can change your setting. For the purposes of this video, what I'm going to do is brush top to bottom 3 times, bottom to top, and you can see my patient moving a little bit, so it's stickier that way. That way and that way, there's not a lot of resistance. So I'm going to continue this way until that resistance changes. And you might be able to hear the device. That's fairly good. So I'll test that way again. That's a lot less resistance for me. Then I'm going to check. So this is our 3rd pass. I've got another one here. Once again, as I said before, you can remain there, you can change your setting, or you can just sit there and then after a minute or so, work those different directions looking for the most resistance. And that's quite resistance, as you can see my patient's going forward a bit. I'm not actually pushing her, the device is actually sticking. There's no stickiness there, so I'm going to continue this way. That's changed. So I'm going to do it one more time just to check. So as you can see, it doesn't take that long. You can also brush this trapezius, which gets quite tight. That's this muscle here. That's quite loud now. So now I'm going to do the opposite side. Same way. Hairline. Still okay with the power?
Yes.
Yeah. And if your patient wants you to turn down, you have to do that. So really good treatment to do on your partner or members of your family to de-stress. It's a very relaxing treatment, especially if you put the device into sedation. Very good. So we've got a sticky spot here. So I'm going to remain there for a few seconds. You're okay with that? And then I'm going to top to bottom, bottom to top, sticky that way, right to left, left to right, so it's still that way. And again, don't do it too quickly, otherwise you're going to miss those sticky spots. I'm stuck there again. Top to bottom, bottom to top, right to left, left to right. And that's all we need to do.